What is going on, everybody? Follow-up video on last week's take on New Brunswick's move to allow grocery stores the option to deny people access to grocery stores based on their medical status. So I just want to take a quick look back at some of the rhetoric that's being put out over the last number of months and how that's transpiring into what is going on today. So let's have a watch.
Our data from the CDC today suggests, that vaccinated people do not carry the virus, don't get sick, and that it's not just in the clinical trials, but it's also in real world data.
So back in March 2021, that was the guidance to everybody. Fast forward a couple short months later to August 2021. Let's see what she has to say now.
Reports from our international colleagues, including Israel, suggest increased risk of severe disease amongst those vaccinated early. Given this body of evidence, we are concerned that the current strong protection against severe infection, hospitalization, and death could decrease in the months ahead, especially among those who are at higher risk or who were vaccinated earlier during the phases of our vaccination rollout.
Why is none of this, information or evidence being taken into account? I just don't understand. I mean, a lot of this information was out long before any of these mandates came into place, but it's as if it doesn't exist or it was completely ignored. The next couple of clips get into some of this hateful rhetoric that if it was directed towards any other group of people within Canada or the US based on, skin color, race, country of origin, any characteristic would easily fit within a human rights violation and could be charged under the criminal code. So to direct that at a particular group of people based on their personal choice, not to take a medical intervention, it's just abhorrent to me. So let's watch these ones.
What more do you need to see? Make vaccinations free, safe and convenient. Vaccine is FDA approved. 200 million Americans have gotten at least one shot. Patient. Our patience is wearing thin. Refusal has cost all of us. Hello.
Like, your patience is run thin. I mean, would you get up onto that podium and say that about anybody else based on their health status? I mean, the messaging behind all this is the fact that people can somehow, prevent themselves from getting a virus. I mean, if you're out and about working and living life, you're going to run into the virus irregardless of what happens. So to completely throw these people under the bus is just ridiculous.
For the past several months, you have heard very simple get vaccinated. The vast majority of Saskatchewan people have done it. Unfortunately, today we are faced with a fourth wave, resulting in increased cases, significant capacity pressure in our healthcare system, which is close to exceeding what we have faced before. But unlike previous waves, this wave of the pandemic is driven almost entirely by one group that consists of about 20 to 30% of our population, those that have made the choice to remain unvaccinated. Cases are overwhelming in unvaccinated. Hospitalizations are overwhelming unvaccinated. The evidence from the data that we have seen is quite clear. As a province and as a government, we have been very patient, possibly too patient. The time for patience is now over. I guess what I'm doing is saying
We've been patient, perhaps too patient. Like, where are these, leaders going to take this? It's just insanity to me that they think that they can talk to people this way. Like, who are you to get up on your high horse and condemn all these people for making a personal medical decision?
I think it's up to you. It's up to you, the people of that. It's up mainly to the 20% who are vaccinated. They don't step up in large numbers to protect themselves, their loved ones, our healthcare system. At that level of unvaccinated population, that this thing is going to go on much longer than it needs to. Here's the irony. I think that the unvaccinated population are those who are angriest about COVID and all that it's done to disrupt our lives. And yet, by their actions, they are prolonging COVID and all that it's doing to our lives. So if you don't like any of this, as I don't, if you don't like any of these measures, if you don't like your loved one's surgery being postponed, if you don't like the lack of certainty that we can provide you with a hospital bed, if you don't like the vaccination program,
No, I don't.
then there's one thing you can do to express that practically, and that is to get vaccinated.
Two policies. One, COVID didn't shut down businesses. COVID didn't ban people from traveling. Government policy did that. Viruses don't do that. That was solely government. Then this constant argument that the healthcare system is falling apart. Why are you firing perfectly healthy healthcare workers? Why have you ignored early treatment protocols? If you as a government are not willing to do any of these things to bolster the healthcare system, how can you sit back and force people to give up their lives if you're not willing to do anything about it either?
Although cases are on the rise, the fourth wave is primarily being fueled by the unvaccinated amongst us.
If it's a mixed group of vaccinated and unvaccinated individuals outdoors, you may consider keeping masks on. And certainly if you go indoors, I would suggest you keep your masks on in a combination of groups of vaccinated and unvaccinated.
I do believe it's a very small proportion of individuals that would commit this fraud. If we continue to hear or see transmission in these settings, it has to be because unvaccinated or are mixing with vaccinated individuals. We will treat this very seriously going forward, especially if our rates go up and or we see transmission in those areas where they should have had verification process. We don't want vaccinated and unvaccinated populations mixing and transmitting the virus.
No mixing.
As we go indoors. I am concerned as we go indoors. We know this virus likes low humidity, that it can stay in the air longer.
Seasonal
in those
virus.
environments, that there is a risk of transmission, and hence the reason we need only vaccinated, protected people going into those venues to keep them safe.
So in terms of the proof of vaccination, we'll continue to monitor the data and make recommendations to government. A basic means of protecting individuals is stopping the mixing of unvaccinated and vaccinated in a
That language is so disturbing. To separate populations based on medical cleanliness it's abhorrent, and it drives this, understanding or acceptance of hate towards these people that no government official or public health official should be saying in Canada. You wouldn't treat people that are suffering from any other medical condition in a similar way. So why has it become acceptable for public health officials to, put out this rhetoric of not mixing, certain people based on their medical status? It's going down a slippery slope. It needs to end now. Or if you look to history, you will see that there's nothing good that comes from this type of language.
Of the 11 cases that have been identified in Alberta to date, 7 of them were in fully vaccinated individuals, 2 were in partially vaccinated individuals, and 2 were in unvaccinated individuals.
We're planning on hosting holiday events and advising to ensure everyone in attendance is fully vaccinated. Vaccination, it appears with the Omicron that it is still transmitted versus vaccinated.
So based on Dr. Dina Hinshaw, 7 out of the 11 were confirmed to be fully vaccinated. I'm sure the numbers have expanded since then. And then this last clip with Dr. Moore, you know, in one breath of this interview says only vaccinated people should be gathering. But then at the, you know, tail end of the interview, he says, well, people that are vaccinated can still get it. So, you know, what is it? What are we trying to, you know, what are they trying to accomplish here? This needs to end now. This hateful rhetoric towards people in Canada is dangerously, dangerously divisive, and it's accomplishing nothing. So I would encourage anyone that doesn't agree with this to speak up, you know, regardless of what the situation is, where it is that you know, might be living, what's going on. Don't listen to this garbage. You know, we're all Canadians. We all have the ability to make our own personal medical decisions. And it is solely based on government and public health that, you know, we're having problems in our healthcare capacity. We're short-staffed in a whole bunch of different areas. The medical treatments that they rolled out here and are now making sure everybody gets a 3rd dose of it now is not working. This is all on government and public health. This has nothing to do with your neighbor, you know, your friends, your family. You know, a lot of people have done everything that they were supposed to based on what the government has said. And what are we doing now? December 2021, and they're calling for more restrictions. So let's work together to end the madness, direct your anger and your frustration towards the government where it is due, and start uniting amongst yourselves, because it's not your neighbor, your friend, or your family that's locking you up and restricting you. It's the government, plain and simple. Take care.